Hi, I'm Steve Smith.
And I'm Lauren Smith.
No relation. We're here today to talk to you a little bit about the Medicare Shared Savings Program that the organization is participating in. One requirement of this participation that CMS gives us is that you have to have a face-to-face discussion with the patient and let them know that that the organization is taking part in the Shared Savings Program, and they have to have the opportunity to opt out of sharing their personal health information. The process is an opt-out process, meaning we have the list of all the attributed patients, and that lacking them signing a form which says specifically that they do not wish to participate or calling the 1-800-Medicare number, we're going to have access to their personal health information in the form of their Medicare claims data. This is helpful to the organization insofar as it will help us to identify where people are getting the care and do a better job. So there are quality and their coordination of care issues at play here. So we want to maximize the number of people whose data we're able to see. The goal of the conversation, again, then, is to make sure that we're complying with the Medicare requirements, but it's also to make sure that the patients are adequately informed and to encourage their participation in sharing their PHI. Some people may be concerned when they hear about sharing data, and they may not understand why it is important to do so. Keep in mind, make sure that they understand that the sharing of information is between Medicare and us, which will be allowing us to see where there are other claims data from other providers they may be seeing. Together, your organization, along with 3 other health centers in North Carolina, will be using this to try to improve quality, to improve the coordination between different providers. As patients, they won't be restricted into how they obtain care, when they obtain care, from whom they obtain care, any more than they are now. Let's talk a little bit about how this interaction can take place.
So, Mr. Smith, have you gotten our letter in the mail recently about our new ACO?
I did.
Okay, well, we just want to tell you a little bit more about it while we have you here in our office. So, our health center is actually working together with Medicare to give you the best care possible. So in order to do that, we've joined together in a new Medicare Accountable Care organization, and this is called the Carolina Medical Home Network, ACO. This ACO is actually made up of doctors from our health center as well as doctors from 3 other health centers in North Carolina who will all be working together to improve the quality and coordination of your health care. The reason that you're in this ACO is because you receive Medicare benefits. Therefore, CMS has placed you in this ACO. What this means is that your personal health information will be used to help us see if we're doing a good job at taking care of you. We will also get information from the other doctors that you are currently seeing. That way we can have a more complete picture of your current health needs. We believe that being part of this ACO will be good for you. However, if you don't want to share your personal health information with us, you have the right not to do so. But if you don't want to share your health information, then you'll need to file the decline to share PHI form, or you're going to have to call the 1-800-Medicare number.
If I'm okay with this, is there anything else that I have to do?
Great. Thank you so much for trusting us with your information. So in this instance, if the patient is okay with sharing their PHI, there's nothing more that they need to do. What you will need to do is actually record in your EMR that the conversation took place.
If I don't want to do this, am I still going to be able to get my health care here?
If you wish to opt out, then that's okay. All you need to do is take home a decline to share PHI form. You can still get care here, but you need to indicate your preference for not sharing your PHI with the ACO. So in doing this, what you'll have to do is make sure that the patient fills out their name and address and signs the decline to share PHI form, or you can fill it out for them. But either way, you need to make sure that you are forwarding this form on to us here at the association so we can communicate with CMS and we do not request their claims data. But either way, you still need to make sure that you record in your EMR that the conversation took place.
What about if I'm not ready to make a decision today?
So if you're unsure, what we can do is we can send you home with this decline to share PHI form and you can think about it. If you decide to share your PHI, there's nothing else you need to do. But if you take the form home and decide you don't want to share your PHI with us, then you will need to fill it out and send it in to the address listed on the form. Or you can call the 1-800-Medicare number. So in this case, if the patient is unsure, you will send them home with a copy of the decline to share PHI form where it is up to them to fill it out and send it back to us, or they could call the 1-800 number. But just as in the other two instances, you will still need to record in your EMR that the conversation took place.
Who's going to have access to my health information?
In being part of an ACO, what this means is that we at the health center will have access to your personal health information, and then we will also have access to other information from the other doctors that you're currently seeing. This also means that other participants in the ACO, more so at the provider and organizational level than the patient level, will have access to your PHI. So no other patients or participants will see your PHI except for providers and those that work for the ACO.
Is this Obamacare?
The Medicare Shared Savings Program originated in the Affordable Care Act of 2010, which is sometimes referred to as Obamacare, but it is not necessarily Obamacare within itself.
If you have additional questions, don't hesitate to give us a call. We really want to encourage people to participate in this as broadly as we can. It will benefit all of our organizations working together. Thank you.
Thank you.